ladies and gentlemen, you're welcome to our very, very first episode of Let's Talk About It. Here we talk about everything health and wellness in an honest and informative way. We are honored today to have as our very first guest, Felicia Dodu. Now, Felicia Dodu is a senior midwifery officer at the Greater Accra Regional Hospital, and she has been practicing for the past 10 years. If you happen to pass by the Greater Accra Regional Hospital, you can find her at the Gynae OPD antenatal unit. You're welcome, Felicia.
Thank you.
So today we are going to talk about vaginal health. So my first question is, what is vaginal health?
Okay, so I want to go as simple as possible so that our viewers can understand it in a simple way. When we talk about vaginal health, we know the vaginal is one part of the body. But if you have issue with your vagina as a woman, it can affect your whole health in total. Vaginal problems can cause the ability to enjoy sex, can cause infertility issues, and then even the desire to reach orgasms.
So which means like it's very, very important to pay attention to it, because it affects not just you, but other parts of your life as well.
The whole body in totality.
So what exactly affects vaginal health? What would make it better and what would make it turn for the bad?
So when we talk about vaginal health, as I've earlier explained, we have so many things that can affect our vaginal health. We may take it for granted, but when it happens, it causes a whole lot of issues in your health. So there are so many things that can affect the vaginal health. One, we have unprotected sex. Yes, that can cause sexually transmitted infection. We have forceful sex that can cause trauma to your pelvic floor muscles. And then we have certain conditions, certain health conditions, and then medications. The health condition can be endometriosis. It's a big word, but that is the lining of our uterus. When the lining of our uterus is missed and then it goes to other parts like the ovary, it tends to cause a whole lot of problems. We have the medications like antibiotics. So please, our viewers out there they will feel unwell and then they feel, oh, let me just buy some antibiotics from the pharmacist. Sometimes too much of it. So it's best for them to consult their doctors or midwives. They get a prescription before buying them.
Okay.
We have age. If a woman is turning into menopause, that is the estrogen level reduces, which can also cause an infection in elderly women.
When you were talking earlier, you mentioned missing the wall of the uterus. What does that mean? How do you miss that? Is it during sexual intercourse?
No, so I'll say that is an abnormal way of it, because this is the normal, but when it deviates from the normal, it becomes an issue.
So then if these are the things that can happen, that can affect the health of the vagina, how then can you actually make it clean and keep the place wholesome?
Okay, what I'll say is that even when you come to the skin, we have some normal microorganisms, not bad, on the skin, where every part of the body, like the nose, like the mouth, like the ear, we have some friendly microorganisms pertaining to that part of the body. So let's say the vagina also have the same microorganisms, but over there, that is a microbiota. It's a very scientific word. So let me just, in the simple way, have some normal microorganisms there that is friendly to the vagina. So when it's disturbed, that is what causes a whole lot of issue. As I mentioned, sex, that is unprotected sex, forceful sex, certain health conditions, medications, vaginal douching, and all that can cause problems to the vagina. So in this case, the vagina have its own way of cleansing. Cleansing itself. So someone may even ask, what is a vaginal at all? The vaginal is a closed muscular canal that extends from the outside of the female genitalia, that is the vulva, and then to the tip of the uterus, that is the cervix. So that's canal over there is called the vagina. So I was saying the vagina have its own normal microbiota that balances the pH of the vagina. So when it's disturbed, like the few things I mentioned, the douching, certain medications can affect the vagina health because the normal microbiota in the vagina has been disturbed. So it can result in a lot of issues in the vagina and cause problems to the woman health. So what we can do to maintain the vagina health, as women, we have to be particular about our vagina, not just anything. If you don't take the health of the vagina, if you don't take good care of the vagina, it can result in even infertility. As I said, the desire for sex will be lost, and then even the desire to reach orgasm and all that. So, one, the vagina, I will stress on it, is a self-cleansing organ.
It's a self-cleansing organ. It doesn't need any other thing to keep it clean. It's self-sufficient.
Yes. So what you have to do is that as a woman, if you are bathing, just use the normal water, wash the external part of it, the vulva, and you are good to go. You don't insert your finger to bring things outside. When you keep inserting your finger, that is what changes
the pH
of the vagina and then causes an infection. So the infection will be the discharges you will see, and you'll be thinking the vagina is not clean, so I have to bring those things out. But if as soon as you stop inserting your finger, bringing out a whole lot of things, you see that the pH of the vagina is well maintained, and then it's a self-cleansing organ. You don't need to do much.
But you just mentioned secretions and discharges. Is it normal for the vagina to have some secretions and discharges?
It's very normal for the vagina to have some secretions, We have the normal vaginal secretion. But what will make it abnormal is the quantity of it.
The quantity of the
secretion, the color, and then the odor.
Okay.
The normal secretion don't have color, don't have odor. Don't have irritation.
Okay, so when you say it doesn't have color, so then, because I know like some of the secretions I have is I wouldn't say it's whitish, but it looks whitish or almost close to the color of water. If water has color, if we would say that.
If it's close to water, that means it's normal. But if it's white, as in white, as like the flower we have here, that means there's a problem. Yes, and then the quantity, you see that the quantity is much, and then there's an odor, there's an irritation, then that means you need to seek a medical.
Irritation being that it's
itching. Yes, some can have redness and all that at the vulva. You need to seek for medical attention.
So is any sort of itching abnormal, or some form of itching is normal? Once there's itching, there's a problem. That's very insightful. Okay, so what then would you say is the difference between vaginal wash and then douche? Because you mentioned that that's one of the reasons why people can have some infections and all that.
Yes. So vaginal wash is just a normal using normal water.
Not even soap.
Not even soap, normal water to just wash the external part of the vagina. That is the vulva. What you see outside, just wash, and you don't wash too much. You just wash, and then you know the place is okay. And then the douching is when you use other chemicals, other things to insert your finger, and then use it to wash the inside of it. That is the canal leading to your uterus. Yes.
What then would you say is the difference between, I know you've mentioned washing the vagina and then using douches, and almost every health show I have watched when it's related to vaginal health has talked about how douching is not right. But everybody, it's no secret that people out there use so many products and chemicals and local remedies to clean the vagina, even though maybe, I don't know whether it's out of ignorance, but now we are learning that it's a self-cleaning organ. So why is it that way?
Yes, that is a big challenge to the health sector, because I had a chance to talk to a lady who was asking me about the same vaginal issue. And she told me that one thing she said was that why are they saying we shouldn't insert our finger? Even if I'm bathing, I know I've washed my hands and all that. And then if you are going to have sex, even some men don't bath and then they introduce their penis into you. So what about that? As we were talking, every part has the microbiota. So God in his own wisdom knows that microbiota around the men's genitalia is also friendly to the vaginal. So I've heard women also saying they can use pepper and garlic to maintain, to keep the vagina tight, to douche and all that. I would advise that it's not healthy. It's not good at all, because the more you do it, you disturb the normal flora there, and then they tend to aggravate them, and then it leaves them with a whole lot of problems. So the cleaning, buying a whole lot of chemicals from the market, using our local stuff to insert in the vaginal, you are causing, it's not a good practice at all.
Because I think what most women are looking out for is the tightness, and then that will lead them to be looking for this other remedies. So then essentially what you're saying is that using scented wipes and vaginal deodorants is not a good idea.
And you talk the vaginal tightness. In a natural way, you can have your vagina being tight even after birth. We have the Kegel exercises. I know most women and a lot of people have heard of it. It may seem simple, but it goes a long way to improve your pelvic floor muscles, and then it can make your vagina so tight. So you don't need to use other chemicals, the pepper, the garlic, other stuff to be inserting into your vagina and douching. The simple Kegel exercise can maintain the tightness of your vagina. And we may ask, the Kegel exercise, just simply, you can do it at any time, while sitting, whilst lying on your bed, standing. It's just like when you feel like urinating and then there's no urine around, what you do, like to hold the urine, that is the Kegel exercise. So in your normal, if you are even at home, at work, wherever, you can hold it and then relax it for a while. The more you continue doing this, you see,
the more you are strengthening the wall. So it's almost like exercise. The more you use the muscle, the more.
So that is a pelvic floor muscle exercise. It may seem simple, but it goes a long way. So no matter if you have given birth to 1, 2, 3, no matter your parity, you can do those exercises to maintain the pelvic floor muscles, improve the tone, so that I can have your vagina being tight, if that is what you want.
That's very insightful. Thanks for sharing that. So then in knowing all these things, okay, I'm in the house every day, I'm not douching, I'm taking care of my vagina, I'm not putting soaps over there, I'm not using any deodorant or wipes. How often then should I go and screen? It's classified as cervical screening. I don't know if that is any different from checking your vaginal health. Is it, and if it is, what exactly is it, and how often should one screen?
So that is one of the important screening when it comes to vaginal health. As soon as you become sexually active.
As soon as you become
sexually
active. If you are not sexually active, you don't need cervical screening.
Yes. As soon as you become sexually active, you have to screen for cervical cancer, the cervical screening once a year. And we are blessed. Most of our hospitals we have nowadays, every year, when it's cervical cancer awareness day or month, there's a whole lot of screening that goes on in our health facilities. So every year, you can just put your ears on the ground. When it's not, you just go for free screening. Yes, because when you don't screen and then it gets to the end stage, it becomes very difficult to treat. So we advise every girl, every lady, every woman, since you're sexually active, once you become a sexually active person, once a year you should go for the screening.
Prevention, they say, is better than cure.
And to add to that, to add to our prevention, we know women, we go through our menstrual
cycle.
Yes, cycle every month, the flow, the bleeding. So I urge every woman, when you have your menses, you don't need to wear the pad throughout the day before, or you are going to bath in the evening before you change. You have to change it frequently, because the more the blood, as we know, is a good medium for organisms to thrive, survive in. So the more you keep the pad for so long, a whole lot of organisms grow in there, and it can affect the health of your vagina.
Yes, so how long would you recommend one to keep a pad on? How many changes should you have per day?
At least every 3 to 4 hours, you should change your pad.
Okay.
Yes, no matter how little or heavy you
okay,
flow,
so that's
because any amount of the blood that stays there for long can be a good medium for the organisms to thrive in. And our panties, our underwears, we have to wash them well, dry them under the sun. We know we have so many people, because of their housing, it's making it difficult for them to even dry their undies, panties outside. Even if it's indoors, the best thing you have to do is to iron them. So that it can kill any. It doesn't matter how many panties you have. The most important thing is how you wash them, how you keep them. That's what matters.
So, Felicia, this evening you have shared a lot of nuggets and wise wisdom with us. So, now that we are wrapping up, when it comes to vaginal health, what is the most essential thing anyone should know? And as the days go by, to knowing how important it is, how it affects our lives, our sexual health, even childbearing and all, what should every woman do? If there's one thing that they are taking away from this segment, what should that be?
One has to be sexually responsible. That is, a person should maintain a monogamous relationship with a partner who is free from any sexually transmitted infection, and then reduce the intake of alcohol. That can also cause vaginal infection.
I didn't even think about that.
Cause vaginal infection. And then get vaccinated. We have vaccines for this cervical cancer and all those. Get vaccinated, and then report to your medical doctor or nurse or midwife if you notice any change in your vaginal secretion, irritation, redness, any odor. You report to the hospital.
So
don't self-medicate, because some of the antibiotics, as I said, will cause a whole lot of changes in your vaginal pH, and then can cause infections.
So where can you go to get vaccinated for cervical cancer?
Yes, I think when you go to any other hospital or clinic, look for the gynae part of the gynae unit of it, and then you'll be directed, or the family planning unit. Okay. Yeah.
So yes. So thank you very much, Felicia, for coming and honoring our invitation to be on Let's Talk About It. Here we talk about everything health, and we are really blessed to have such an insightful woman to really bless us with your knowledge as well. I'm sure our viewers would really appreciate the knowledge that you have shared. If there's one thing that I'm taking away from this, is that the vagina is a self-cleaning organ, and it's also a muscle. So if you don't want to keep it tight, you can exercise it just the same way we exercise our muscles to be able to make it strong. Thank you for being on here. So this was our very first episode of Let's Talk About It. Here we talk about everything wellness and health in an informative and honest way. We were blessed to have as our very first guest, Felicia, who spoke to us about vaginal health. If there's one thing I'm taking away from this, is that the vagina is a self-cleaning organ. I don't need to put anything there to make it clean. And I hope my sisters out there, my mothers, my aunties, you're also taking that on. Please don't be deceived by any person advertising that it would make it more tight or anything. There's an exercise you can do, because that organ is also a muscle, as we have all learned today. So another episode, we're also going to talk about health and wellness. Catch us next time, and thank you for being here with us.